So I'm going to I don't usually do this so formally, but there's been a lot of advocacy opportunities that I've been emailing about, and um, there's been various staff who've participated in different ways. So I wanted to kind of give a overview of like our advocacy actions over the last like two-ish months where things have been really heating up. So I kind of put together a just a visual to keep us going. Um, so, just for a little bit of context, we added advocacy to one of the agency's strategic objectives, at this point almost 4 years ago. And it looks different at different times. This last round, when we updated the strategic plan, there was an ask for people to have opportunities to also take part in advocacy alongside us. So that's where you see more emails coming out saying, like, you can submit a public comment or you can come to make a comment, really trying to use our collective voice. So we have been doing like work in two arenas in the last couple months. One is locally. So in Alameda County, we've been working closely with the Board of Supervisors and the Health Committee to try to get bridge funding. Oh, essential services funds is what my slide says, but it's meant to say funds. And that work is really around the impact of Prop 1 implementation in Alameda County, which goes into effect July 1. Prop 1 diverts funds away from prevention and early intervention behavioral health services towards housing interventions. This was a thing that voters voted on about 2 years ago, and it has a pretty big impact on CSS and other agencies in Alameda County. A total of $53 million in programming cuts were doled out a couple months ago in preparation for Prop 1 implementation. And since we all got our letters, the agencies, we have kind of worked together to educate the Board of Supervisors on what does it mean to lose so much of the behavioral health infrastructure. And we've been asking them to provide bridge funding so there is not a major drop off in services and things like that. So that's the local work that we've been doing. And statewide, we've been working directly with the California legislature on the 988 system and the exponential growth that it has experienced in the last couple of years since the implementation of 988, but really focusing on the last year. In the last year, the state of California has had a 40% increase in call volume. CSS has had a 60% increase in call volume comparing March of 2025 to March of 2026. And one of the major areas of concern in California is that approximately 35 to 40% of texts and chats coming in from California are able to be answered in state. And this is because the centers don't have enough funding to scale up to meet the demand for chat and text in California. And the reason in-state answer is really important to us and to our communities is that when you get an in-state answer, you're more likely to be able to get connected to an appropriate resource as opposed to when you're getting a backup center anywhere in the country, they're more likely to do a law enforcement response. So that's one of the reasons we've been really advocating for increasing the in-state answer rate by investing in the 988 system. So what that has looked like in the last couple months, starting in March, that's when we really turned it up. On behalf of the Behavioral Health Collaborative of Alameda County, I presented to the Health Committee about the impact of the cuts. And really, the reason that I was presenting is because CSS has a unique voice in the county as the people who hold the end of the continuum of care, running the county's crisis line and crisis services in general. We're able to say if the services along the continuum are cut, it's going to put an undue burden on the crisis end of the spectrum. And that is not a place where you want everyone entering the system. You want to have a appropriate level of care for the distress people are in, as opposed to making it that no one has access to anything until during crisis. We had staff and volunteers submit public comments for that meeting. We had people there in person making comments. There was over 60 people who made comments from all of whom were part of the behavioral health system here in Alameda County at the 3-9 meeting. And that really kind of changed the trajectory of things a bit, in that it put into motion a series of other actions that are getting us closer to receiving bridge funding for next year so that there will be no cuts to the behavioral health system for the upcoming fiscal year. Parallel to this, there is Measure W in Alameda County, which is a housing and what they call essential services tax. And we've been working on making sure that behavioral health is being funded alongside housing. So that's what that work was on 310. I know we had some orcas there talking. Um, we were able to get Supervisor Miley has been kind of the champion of our ask during this time. So he convened a meeting between organizations and the health system and really kind of was like, we're basically going to stay in this room till we figure this out. So really forcing the conversation and not taking, well, we have to have cuts as an answer. So really big kudos to him. Um, Then there was an email that went out asking all of you to submit your comments regarding the Behavioral Health Services Act integration. And this one I want to highlight because they reported back on it at the meeting earlier this week, and they said they got 109 total responses in Alameda County. And they said this was the most responses they've ever had in this process. This is a process that's mandated by law. That Alameda County has to ask residents and people who work here their input into how the behavioral health services are being rolled out, and they have to prove that they're taking it into account. And I wanted to highlight that 109 number and say, honestly, if we were really able to mobilize CSS, we could take over this entire process. Like, I say that slightly tongue in cheek, but the reality is that's the process. The systems that speak the loudest or they have the most input get the money. So if the entire county is being planned, the services are being planned based on 109 comments, like CSS could really up our input and really swing things towards services that we think are essential. And it doesn't have to just be us. Like people who got my email know that I always say like, you all have a unique perspective. Share your perspective. So you don't have to speak on behalf of CSS, but I think any participation benefits the broader system. And so I also made an in-person comment on that. There was kind of a final meeting. Lastly, on Monday, there was a special meeting of the Health Committee to talk about bridge funding. Andrea and Jen Johal were there in person. Jen Marshall and Sarah Kim spoke via Zoom. And I know for a fact that others emailed me saying they had submitted written public comment. At this meeting, the Health Committee did approve $53 million in bridge funding for behavioral health services for the coming fiscal year. And they called for a special meeting of the Board of Supervisors on May 19th because the full board has to approve this. So as we get closer and we get details on that, there might be kind of one last call. The Board of Supervisors has 5 members, 2 of whom are on the Health Committee, so we know we can count on them to come in as yeses again. And obviously behind the scenes, I'm meeting with people, I'm making sure we have their vote, but we cannot kind of let go of the gas pedal at this final moment. We have to keep showing that there is community support for behavioral health services in Alameda County because at the end of the day, elected officials also care about being reelected. So I just kind of want to keep it real. I'm checking the comments. Yeah, Morgan, this is 100% true. Morgan's mentioning how frustrating it is when things are on the ballot without clarity around what's being cut. And this was truly a case of um, like it passed by such a small margin, but it was a case of people not truly understanding the impact on the broader system. Like we all agree that housing is tremendously important and housing is a right and people deserve to be safe and have a place to be. And if their basic needs are not met, they're not able to be well and thrive. And yet, to make that possible at the expense of behavioral health services feels counterintuitive at best because we also know, doing the work that we do, that when people are not well, they that could also put them at risk of losing housing. It could put them at risk of not being able to show up to work to get paid. So they oversimplified the issue to get the votes, and now there's almost nothing that people can do because it was passed by the voters. So the only way to change the implementation is to go back to the voters, which is a whole thing, right? Um, yeah. Yeah, and 109 people out of a 1.7 million population is very small. Um, and what's amazing is how much pride is taken in their community input process. Like this was presented to the health committee on Monday as like, you guys, we had the highest turnout. Andrew, do you want to make a comment?
But yeah, I just wanted to acknowledge you, Nargis. Just so appreciative of the ways in which you involve us in these advocacy opportunities. I've never worked in an organization where I've been so encouraged and given the space to and the possibility to come and go to a board of supervisors meeting and comments, and the fact that everybody volunteers, everybody at all levels is encouraged to participate in this advocacy. It's really unique. And so I want to acknowledge you for how you're engaging us, and then also acknowledge just like the tremendous hard work that goes into this. I think we're really lucky to have you as our director and to be facilitating all of this change and showing us like really how the work gets done from behind the scenes.
Thank you, Andrea. Yeah, like I do believe that like we all can make a difference and like as people who are offering services at as part of the crisis care part of the continuum, it's almost like I feel like it's our duty to make sure that we're not the only ones remaining at the end of the day. And I think that's what a lot of this is about. Out of this $53 million, the CSS portion of the cuts is 600,000. It is not, it's significant, but it is not existential for CSS. There are entire agencies that are getting wiped out because of these cuts, and they provide really key services. And I think the only way to keep the system intact is if nobody thinks like, oh, I'm not impacted, so I can sit at home. Like, I think all of our voices are really important in maintaining these services for our community. So that's kind of what's happening locally. We'll have kind of a hopefully a final kind of resolution on the current round of local advocacy on the 19th when the full board votes on the bridge funding. And the reason for the bridge to be like transparent is not to just like kick the can. It's that a lot of the funding mechanisms that the county could have access to actually fund some of the programs being cut haven't been set up by the state yet. One really like prominent example for CSS is the State Department of Public Health will be doing community education funding for community education programs at 988 centers specifically. Um, and they have said that, but they don't have a timeline yet. So it's really important for us to be able to maintain our programming while we wait for new funding to become available. There are other parallels as well to this. There is funding coming down the pipeline for workforce development programs that currently had gotten cut letters from the county, for peer support programs that had gotten cut letters from the county. So for some of the cuts, there's a true misalignment between when the cuts are going into effect and when new funds would be available to them. So the bridge is it's a practical move. It's not just us being like, hey, another day, another dollar. We are trying to maintain the like integrity of the system while the infrastructure gets put in place to support some of the programs that would be cut otherwise. All right. So then there's been some stuff going on statewide, as I said. Um, statewide, things also started around the same timeline. So the California 988 centers together have formed a 988 California, which is a consortium of crisis centers, and that happened like 3 years ago. And that group together has like a unified voice on behalf of the 11 centers in California, making sure that people are aware of the needs of the centers and the like service delivery dynamics. That includes things like call acuity, follow-up requirements, people who fund us and people who oversee the legislation, AB 988, that in California has oversight over the 988 centers, rarely know exactly what's going on. So I did office visits on March 25th with staffers for people who are part of the health committee specifically. We're in a really good position in that Assemblymember Bonta, who is the assembly member for where CSS is located, is the chair of the health committee in the assembly. So it makes it that they take meetings with us pretty easily because we're a constituent, and also she's in a position of influence, and she understands the issues pretty well. Um, then I presented at an advocacy conference about how do we turn like about local to state like mobilization models, which was informed by our work at 988 Consortium. Um, there's a lot of kind of parallel processes happening around the funding for 988. Just like a quick, I don't know, one sentence overview. 988 system in California is funded by a 988 surcharge that all of us pay on our phone lines monthly. If you look at your cell phone bill, or if you still have a landline, your landline bill, you are paying currently 5 cents a month toward the 988 surcharge. You also pay like 30 cents a month toward a 911 surcharge. So the 988 surcharge is meant to fund the centers. Our biggest kind of, I don't know, area of friction is that the 988 surcharge was at 8 cents per line per month as like through last year, and was reduced this year because of some like because of not talking to the centers, because of like the political dynamics around how the surcharge is set. So that's what made it that the centers went directly to the legislature, because we felt that we had been cut out of the process, basically. We found out on the internet that the surcharge had been reduced. That's how much the centers were not at the table. And we are trying to now communicate that that's unacceptable by going to anyone who will listen. Um, and that has included kind of testifying at the Senate Budget Committee. So I had a chance to be kind of like I forget what they call it now, like, oh, subject matter expert on behalf of the 988 centers. And I testified in front of the committee. This is a picture outside of that committee of other people from other 988 centers that had shown up to make public comment following my testimony. So adding kind of their local flavor. This is a real picture of the line of people lined up to make public comment. This matters. Like, lawmakers listen to people who show up, and the kind of, I don't know, the thing about the hearings in Sacramento is that they only take in-person public comment. So it is always kind of a whole trek. It's a big commitment, but it is important because every time we go up, it has opened other doors. So I had initially been invited by a state senator to come and do the testimony in front of the Senate one. And immediately following it, I got invited to come back and now testify in front of the assembly budget subcommittee, and Cece was there as well making public comment. There's a picture of me testifying, and it happened to be on May the 4th. So we did not know this, but there was a lot of Star Warsy people at the Capitol. So while our hearing was delayed for 2.5 hours, we walked around and took pictures. And again, these are some folks from other centers. We have two people from San Francisco. We have Contra Costa. We have two people from the North Bay. So people like continuously showing up to make comments. This meeting went till like 9 p.m., y'all. So like, again, really big appreciation to people who come out because our voice does make a difference. And last but not least, this is yesterday. Um, as a result of kind of our complaining, the Assembly has launched an oversight endeavor into 988 implementation to better understand what is happening with 988 in California and why is it that regardless of having a dedicated funding source, the centers don't have enough funding to be responsive to the increase in demand. So on the right here is Assemblywoman Rebecca Bauer Cahan. She represents Eastern Alameda County and Contra Costa County, but she's the person who originally introduced AB 988. So she's here asking me questions about the implementation yesterday. And on the left is a picture of me testifying in front of the Health Committee. Our end game here is to kind of, it's a little bit twofer. One is like an immediate infusion of funds into the California 988 centers, primarily for text and chat expansion, but also for the calls. And the second one is for the state to create a funding methodology that includes center input, as opposed to a funding methodology that currently takes place between Department of Healthcare Services and California Office of Emergency Services without any center input. The current methodology uses data from the previous fiscal year. And because our system has been so dynamic and because there's been such major growth, funding us based on previous demand is kind of guaranteeing that the system is underfunded. So that's kind of what the systemic change is that we're asking for, but kind of more imminently, the centers are asking for funding to ensure that we can meet the increase in demand in our communities. Um, so, any questions? I know that's a lot, and like, I think sometimes, like, as the world is like going through some like dark periods, is fair to say, it's easy to feel like, I don't know, for me, maybe I'll speak for myself. It's easy to feel like, what's the point of anything? And for me, it's helpful to put our work in the broader context of what's happening, in that when you show up at CSS, your work is connected to a to dozens of behavioral health organizations in Alameda County who come together to create a safety net for our community. When you pick up a 988 call, chat, or text, your work is connected to 2,000 counselors in California who work every week to make sure that contacts are answered. In the last 12 months, 600,000 988 contacts were answered in California. So this is a system that is growing exponentially. And one of the things I want like us to be able to hold like with tenderness in the midst of the madness is that those 600,000 contacts are people who are trusting a stranger in a moment that they don't know what else to do. So, like, my role when I do advocacy is often try to connect the people in decision-making power with the promise we're making people when we put 988 billboards up in our communities, and to create accountability around, like, if you make a promise like that, you have to ensure that there's people here to answer the call, like literally and figuratively. Because like the ramification of broken trust is just too big. Because if we lose the trust of the people, the system is then it doesn't matter if 98 has all the money if it doesn't have the trust of the people who need us. So um, that's why I wanted to kind of bring you guys in a little bit on the bigger system so that you know that you're part of something. And if you have a shitty day, know that you're still part of something that's making a difference. Okay. Related or unrelated, any comments, any final things before we wrap up today? Oh, thanks, Sarah. Yeah, we are the people too. I love that. Great. Well, really appreciate everyone for. Oh, one last thing. There was a study that was just published in Journal of American Medicine, JAMA. Journal of American Medical Association that showed an 11% decrease in youth suicide since the start of 988, and they were actually able to create like a causal relationship between places where 988 has had the largest growth and like those places have had the largest decline in youth suicide. So like also like it works. Like we know it works, but it's really nice when someone else studies it and they're like, "Hello, this works." Um, Let me put a link. The New York Times had a link, but it's that one is like behind the paywall. But I think you can actually see the real one. Here, I'll put it in the chat. But if not, you can just look up JAMA 988 and it'll come up. Oh, thanks, Jonas. Jonas thinks he might have a PDF on the training team. Yeah, that's a good idea. Um, so thanks everyone for stopping by today. We'll see you soon. Have a good rest of your day. Take care.
Thank you. Bye.